Now we talk on shift work and diabetes. Shift work is associated with adverse metabolic effects which may have a negative effect on managing diabetes. Shift work may not suit several treatment regimens for diabetes. Shift workers often have difficulty developing a routine for the medication, diet, exercise, and sleep. Working night shift or swinging shifts can cause erratic blood glucose changes. Finally, many jobs that require shift work are exceptionally stressful, and stress also will cause you to have a higher blood glucose level. Now, this is the schematic diagram on the effect of circadian rhythm disruption on the different body systems. Listed down are cardiovascular disease, neurological and mental, and metabolic syndrome, which include dysglycemia. Now, talking about dysglycemia, here is the mechanism of sleep disorder and development of type 2 DM. Obstructive sleep apnea syndrome, short sleep duration, circadian misalignment, all leading to glucose intolerance and type 2 diabetes. So, the principle of the diabetes care in shift workers. Number one is self-monitoring to understand the blood glucose pattern to allow treatment adjustment. Number two, meal planning is important. Every spaced meal, 4 to 5 hours apart, consistent types and amount of food, understand when medication works, and its duration of action when planning food, and readily available hypoglycemic treatment. Number three, exercise. Be aware of the potential for exercise-induced hypo, especially overnight. Now, in terms of pharmacotherapy, okay, we have the oral agent, metformin, unlikely to cause hypoglycemia. SU timing should match food intake because this is associated with hypoglycemia. Other agent timing less important. Other injectables, GLP-1 receptor agonists are unlikely to cause hypoglycemia and therefore timing not as important. Now, with regards to insulin regimen, the premixed insulin regimen is quite unsuitable for shift works because it's a fixed and not flexible. Okay, basal bolus regimen most physiologic and suitable for shift workers, ideally once a day basal analog. Okay, once daily basal insulin, if dose correct, should remain unchanged whatever shift is being worked. Those on twice daily basal insulin and insulin pump will need to adjust their day and night background insulin depending on whether working or sleeping. Okay, bolus insulin to carbohydrate ratio will need assessed for overnight meals and should be administered with meals whenever they are taken. Okay, so we go to a simpler insulin regimen. So when we use basal insulin like Largine, Determere, and Degludec, these are basal analog. No particular adjustment should be required. For the intermediate insulin, the isopane may less be suitable for shift work. Premixed insulin regimen, again, this is quite unsuitable for shift workers. So that's the end of the introduction, and we go next to the case study.